Begin this report with a spotlight on the Equitable Vaccine Initiative currently underway in Newark, New Jersey. The program is, and of itself, worthy of a closer look at its work, simply for its success in convincing thousands of historically skeptical Black and brown residents to get the COVID vaccine and bolster the collective health safety net.
I grew up in a household where the message was, to whom much is given, much is expected.
But as it turns out, there's a key figure behind Newark's Equitable Vaccine Initiative, who also deserves the spotlight. Dr. Denise Rogers is Vice Chancellor of Biomedical Health Sciences at Rutgers University and the medical advisor for the initiative.
And I think my parents demonstrated in their own lives giving back. And so, of course, it was expected that I would do that as well.
A native of Flint, Michigan, Dr. Rogers grew up believing she would one day practice medicine in a Black and brown community somewhere in the Deep South. But then a medical school course in a hospital in the Bronx gave her a taste of practicing in a more urban setting, and she was hooked. Fast forward to 2022, and Dr. Rogers admits providing medical care in a big city isn't a worry-free experience, especially in the era of a highly politicized coronavirus pandemic.
I, as a physician, am humbled by the degree to which we have failed to have people understand how science works, how medicine works. I am also humbled by the level of people's fear.
Justified fear, highlighted by the Tuskegee experiment and other studies secretly conducted on African Americans over the last 2 centuries.
It is one of my greatest frustrations and sorrows, and I'll tell you why. Because on the one hand, you have this enormous suspicion of this vaccine, and on the other hand, you have Black and brown people dying in disproportionately high numbers from this disease. So the very thing that could help to prevent death is the very thing people are so afraid of getting.
But Dr. Rogers says the work of the Equitable Vaccine Initiative is paying off.
And then we get some of those people that they know and trust to get vaccinated. And they see they do fine. And then they say, maybe it is okay for me.
Dr. Rogers says she understands why some people in the general public are tired of hearing about century-old injustices, but she adds her work must continue.
I'm tired of it as well, quite frankly. I'm tired as an African-American woman from the time that I was 5 years old, living in a world where I am reminded very frequently about the fact that I am Black and about the fact that many, sometimes even in the academy, view me as being less than. So I'm tired too, but I am committed to fixing this problem.